Theresa and Michelle Gehrke-Herwynen have been married for 24 years. They met when Theresa basically crashed a church potluck at Michelle's house. Theresa had been invited to the church's Parents and Friends of Lesbian and Gays meeting, but had some time to kill before it started.
And so my friend said, "Come to our friend's house. We're having a potluck." And I'm like, "I can't come to your friend's house. I don't know your friend." They're like, "We'll let her. We'll call her. It'll be okay." Well, it was Michelle's house.
Theresa and Michelle have been living in Bemidji for about 4.5 years.
These are the fur babies and our great comic relief. This is Quimby Timber, otherwise known as QT. Come here, Nika. Come on, you're good. Come on. And this is Nika Leah.
You'll probably hear the dogs in the background occasionally. Theresa is the chaplain and bereavement coordinator at Sanford Bemidji Home Care and Hospice.
My first call in ministry was about 15 miles away from Bemidji, and I've always wanted to come back.
Up until March, she also provided chaplain services to the Sanford Health Hospital and Nursing Home in Bemidji.
Provided support to my colleagues, staff people, and that some of the support I can give there too has to do with supporting people who are caregivers.
And Theresa has a unique insight into the working caregiver role. She's been Michelle's caregiver for about 5 years. Michelle is diabetic and has had multiple broken bones because of her diabetes. She also has dementia.
So my experience with Sanford caring about my family started even before I came here.
She was offered the job at Sanford Health, but wanted to make a trip to Bemidji first. They were living in Sioux City, Iowa.
I hadn't been here for several years, and I wanted to meet the person who would be my boss. And Michelle had fallen and broken her tib-fib and had emergency surgery, so I wasn't able to come at the time I said. And
at that point, Theresa thought the transition would be too much said she wasn't taking the job. That was Friday. On Monday, Theresa received a phone call.
"This is Sanam from Sanford and Bemidji, and I just called to tell you that we have decided that we want to wait for you to come to see if Bemidji is as good a fit for you as it is for us." And so I immediately decided that I wanted to come here at that point in time.
Michelle had to leave the interview because the ride to her adult day services program arrived.
Excuse me, they're here to pick her up. You got that walker? Got your bag? You got your insulin?
Yeah.
You're sure?
Yeah.
Okay.
Michelle uses adult day services in Bemidji, and Theresa stressed that it's this program that has allowed her to stay at work. A report by the Rosalynn Carter Institute for Caregiving highlighted what they call invisible overtime, the often unseen work of family caregivers. The report estimated that 18 to 22% of the U.S. labor force is made up of family caregivers, and close to 1/3 of caregiving employees have left work at some point during their careers because of caregiving responsibilities.
And we can easily start to think of all the implications of that for the person financially, but I'd also suggest all the implications of that for people's social connectedness. We talk to caregivers who say going to work is a type of respite or a break for them from their caregiving role. One of the toughest things for both employers and employees is we don't have a great language of describing this. When we say caregiver, that means all those different circumstances I just described, plus, an infinite number more.
Dr. Jennifer Olsen is the CEO of the Rosalynn Carter Institute for Caregivers. An epidemiologist by training, Dr. Olsen took a break to support her parents who were in caregiver roles.
And I realized we don't have supports or systems in place for what Mrs. Carter calls the invisible front line, the person behind the care recipient. 53 million family caregivers in this country, that's a pretty big number, but systems and structures aren't aligned.
Dr. Olsen described 3 challenges perpetuating this invisibility. First, people don't see themselves as caregivers.
They say they're just the brother or sister, mom, dad, husband, wife, caring for or honoring or respecting the person that they are supporting.
The second is that working caregivers don't always have the time to call their congressperson to advocate on their own behalf. And third, much of the support centers on the person or population that's in need of care, not the caregiver.
So if you're an Alzheimer's or dementia caregiver, these are your program offerings. If you're a veteran or military caregiver, these are the offerings that we have for you, rather than an approach that is saying to someone, are you new to caregiving? Is this your fifth person that you're caring for? Do you need coaching or mental health services, or do you need help with housework? Then let's figure it out. Let's center it on you, the caregiver. One thing that we're thinking about at the Institute is how can we have a language that would work for both employers and employees, kind of like personas around the caregiver experience, so that as an employer, I can set up benefits or flexibilities and know that they're going to work for maybe 4 out of the 8 kinds of caregivers. And employees can say, oh, those are the types of benefits for a person who's like me in this situation. Those are what I should go after.
The types of support that working caregivers need can be as varied as the individuality of caregivers themselves, and Theresa said that Sanford has been quite supportive. They offer well-being and mental health care, virtual and on-site counseling, and various personal and medical leave options. And the leave department at Sanford is really the linchpin making all of this work, explained Ashley Gagola, Director of Home and Community-Based Services at Sanford Health.
Having a leave at other organizations, just having that paperwork handed to you without the real detailed explanation can be overwhelming. So I think it's really having that content expert who really knows the details involved in those leaves is probably really the key that makes it successful.
But Theresa also said that her individual knowledge of the hospital system and knowing whose brain to pick about particular services has helped her understand what's available.
So that's been as helpful as anything, is just to think about who might be able to help me in that system, that it might not be an official part of Sanford's policy to support employees, but it is easier.
One of the, I think most important things to Sanford is that we talk a lot about well-being and making it so that employees feel like they can bring their whole selves to work and their best self to work. One of the most difficult barriers is that not everybody comes to work and identifies as a caregiver or raises their hand and says they need help.
While smaller businesses might not have the capacity for an entire leave department, Wenger-Slaba says the first step in helping to support working caregivers is open communication.
I think it's really important to consider who can kind of be the friendly open door that they know they can come to for these concerns, whether they know and can identify what the need is yet or not. And then I think the other piece is, particularly if you're a smaller employer or maybe have limited resources, thinking creatively through how you can meet those needs. There isn't a one-size-fits-all approach. It really is unique to each individual, and just, kind of partnering with that employee through their journey as a caregiver, and not having any, preconceived notions about what each person might need.
To be honest, even identifying working caregivers to talk about their experiences for this story was difficult. Perhaps once a caregiver vocabulary is built, language reflecting the needs of caregivers will become apparent, and the ways that working caregivers can be and are being supported in any workplace setting will be easier to identify.